Hey, it's Rob Potash with CSMI, and welcome to episode 9 of Isokinetics 101. This episode's kind of a special treat. It's the result of requests that we had from last month's episode in regards to how do we do an isokinetic test or an interrupted stroke test from put my patient in to printed report. Daniel was kind enough to come to Boston, and we grabbed a couple other people to join us at CSMI HQ. We filmed um, doing the interrupted stroke test and also a traditional isokinetic concentric test. And then he went to town, edited it up. So this episode, what you're going to see is start to finish how to do an interrupted stroke test and an isokinetic concentric test. Not shown is our hero, John Hisamoto, but he was kind enough to call in from, I believe, Montana. John, are you out there?
Actually, I'm in Denver right now. I just got into Denver today.
Not shown is John Hisamoto from Denver. Go ahead, John.
So thank you guys. So again, a phenomenal effort by Daniel. Last month we went over the science background behind the interrupted stroke, some of the concepts that we wanted to do, kind of talked about the start to finish. Tonight, what Daniel's going to do is really show you how to perform an interrupted stroke test. So in my mind, this is probably one of the most important webinars that we're going to be hosting this entire year. And credit goes to Daniel for all the effort and work that he's put in these last few weeks to kind of get this up and running. So Daniel, when you're ready, it's all yours, man.
All right, let's get started, everybody. So first, here we go. Let me knock out my webcam. And again, this is episode 9. And you've seen all these slides before. Like us on Facebook, send questions to Rob, register your clinic at cybextest.org, get caught up at isokinetics101.org, and always check out CSMI Solutions as well. Here's our usual shout outs. And then again, as Rob and John said, we're going to continue on the isokinetic testing topic. The next couple months, we're going to go into the plans of care, how you implement this and the progressions you use isokinetically. And after that, in December, we're going to have a little potpourri episode where we kind of throw in some things. How do you calibrate a machine? How can you apply blood flow restriction training applications with isokinetics? So we're going to throw all that in December. So stay tuned for that. We've got some exciting stuff coming up for you. And again, we are talking about testing. And the big thing is, where do you want to test your athletes? Do you want to test them on the field, getting tackled, or in the clinic? And I say we test them in the clinic. So let's go ahead and get started with our videos. First up, we're going to show you how to input a patient, how to write a protocol for the interrupted stroke test, and then we'll go into the interrupted stroke test.
This video will teach you how to add a patient. Click on the patient button in the top left side of the screen. You have buttons to add a new patient, edit, or delete. Next to that, you have buttons for last test and last exercise. These are shortcuts to take you to the last test or exercise the patient has completed. The complete button will take you to the last test or exercise that was started but not completed. You can search for a patient by typing in their last name. The software comes preloaded with one patient, Rob Potash, the Vice President of CSMI. Let's create a patient. Click the New button. Under the General tab, put in the name. Let's name our patient McFly Marty. If you want to give the patient an ID, you can, but I only do this for research. Put in the patient's birth date, height, and weight. I'm using US units, so height is in inches and weight is in pounds. You can either use the keyboard or use the number button. Next, select the patient's gender, preferred side, and involved side. For tester, click on the drop-down menu. Go to the bottom of the list for Edit List, click on the Add button, and type in your name with your credentials. Click OK on both screens, and then select your name from the drop-down menu. Now let's go back to the top of the screen and click on the Injury tab. Let's put in a diagnosis. Our patient has an ACL tear. If your diagnosis isn't present, you can go to the drop-down menu, click Edit List, and click on the Add button. Here I'm going to add osteoarthritis. And now you can see it was added to the list. Click the OK button and reselect the diagnosis. Also, put in the injury date. Now click on the Surgery tab. Let's go to Edit List. Let's add in reconstruction, patellar, bone, tendon, bone graft. Next, put in the date of surgery. Now, since the software is new for us, we don't have any of our surgeons built in. So let's edit the list. Let's click Add. And our patient's doctor is Dr. Emmett Brown. I also like to use groups. So for group 1, this is the overall group. Let's add in group ACL. And now let's give them a subgroup. So let's edit the list. In the subgroup, I use examples like soccer high school, soccer professional, baseball high school, baseball professional. But let's make our subgroup for this patient time traveler. The third tab at the top, INR-TEK, allows you to submit your patient's data to a testing service. When you're all finished, click OK. From the main screen, click on Utilities. Click on Protocol Editor. Select the appropriate pattern, in this case, knee flexion extension. Make sure Testing is highlighted and click Add. Name the protocol Interrupted Stroke, Quad, Ham, Concentric, Eccentric, 60 degrees per second. Click Add for the first set. For mode, select Isokinetic and click Interrupted Stroke. Under Action, select Concentric Extensors, Eccentric Extensors. You have to select at least one trial rep to get a warm-up set, but the number you select doesn't matter. Set termination reps to 3. Keep the speed at 60 degrees per second in both boxes. Keep the torque limit at a maximum and set torque threshold to 10 foot-pounds. Keep threshold mode on Continue. For the eccentric torque limit, also set this to a maximum with a torque threshold of 10 foot-pounds and over torque mode set to isometric. Keep the feedback on torque versus position. Click OK to exit and click Add to write the second set. Keep the mode on Isokinetic interrupted stroke, but set the action to concentric flexor, eccentric flexor. Make sure you change the termination to 3 reps. Set the torque limit to a maximum and set torque threshold to 25 foot-pounds. Because the concentric hamstring begins with the knee in extension, you have to take into consideration the weight of the limb. In eccentric torque, set the limit to a maximum, but you can set the torque threshold here to 10 foot-pounds. The weight of the leg doesn't assist the hamstring in the eccentric mode. Remember to change over torque to isometric. Once you're finished, click OK to exit. You can see the saved protocol in the list on the left. In this video, I'm going to show you an interrupted stroke test for bilateral quadricep and hamstrings. First, select your patient from the patient menu, then click Test, select the joint and position, and then the protocol, and then click OK. You're going to get a warning of high torque, high speed. Just go ahead and click OK for that. Now when filming this video, sometimes my mouse pointer disappears, so I'm going to highlight what I want you to click on in that case. Click on Gravity Correct Torque Data, and then click on All Sets. So now we're going to set up our patient. And while we're doing the setup, I want to introduce her. She's a 32-year-old CrossFit coach, and she's been having left knee pain for about a month now, and she doesn't remember any specific mechanism of injury. Now, it's not stopping her from exercising, but she's having to change how she's doing it and modify her reps, sets, and weights. Now, it's important to wear the seatbelt for this, especially when doing the quadricep. Eccentrically, that patient's going to raise up in the chair, and having the seatbelt hold them down. And when they do the hamstring, they're going to try to slide out into the chair when they're loading eccentrically. So the seatbelt is important to keep them in position. Also, make sure you're taking your time on alignment. It's always important, but especially when you're loading at maximal 100% effort into the eccentric, having that amount of torque going through the knee joint, you want to make sure that you're lined up perfectly. That way you reduce any kind of irritation that could happen in the joint. And you'll actually see later in the video when we're on the other leg and we're warming up her quad, she has a little bit of pain, so I make minor adjustments to her position and that takes it away. Remember to always test the uninvolved limb first and make sure they're good and warmed up. And here's a side note on being warm, right? So if I'm testing an athlete for return to play, and I want to make sure they're not just warmed up, but sometimes I want to fatigue them out completely. That way I see how they perform in that fatigue state. So keep that in mind. If this is a return to play test versus just like a progress note test or a baseline test, you want to make sure that they're in that fatigue state. So let's set the anatomic 0. Now when you do this, have her extend completely, then back it down a little bit. Not only do you want to get rid of any hyperextension, but when she's loading eccentrically into her quads, she's going to sink down into the chair just a little bit, and that's going to take her into hyperextension. So keep that in mind, just a slight back off of that full extension. Set the maximum extension to 10 degrees. That way she's not eccentrically loading through the screw home mechanism. And then set your flexion to 90 degrees. You have to standardize the range of motion. That way your work numbers match up limb to limb, and then when you retest, you have the same range of motion for the same reason. That way the work per rep numbers that you're taking for strength match up. After you set your mechanical stops, click on OK, bring the limb to full extension, and click Lock. We're going to weigh the limb for the gravity correction. So once she's relaxed, click Weigh Limb, then click Unlock and OK, and then you're ready to start the warm-up. So this is where I'm going to lose the mouse pointer again. So when I say click next rep in concentric or eccentric, this is what I'm referring to. So we call this the warm-up, but really it's more of a familiarization. You got to teach that patient how to perform the concentric and eccentric reps of each muscle group. We always do 2 reps of 50% effort, 2 reps of 75% effort, and then 1 rep of 100% effort. If you want to do 25% effort, you can, but I like to just do 50, 75, and then 1 at 100. Everything we're doing for right now is for the quadricep. So concentrically, she's pushing up as the machine moves up. And then with the eccentric, she's pushing up as the machine moves down. And you got to cue the patient to keep pushing all the way through the bottom of the range. Lots of times they'll like to give up in those last 10 to 20 degrees. Either it's a neurologic issue or they just anticipate the end of the range of motion. So watch your curve lines as you want to get that typical quadricep ascending descending curve. And if you're not getting that, make sure you cue them into the proper way to perform. So now we're on the last warm-up for the quad. That was 100% effort concentrically.
and this next one is her 100% effort eccentric rep. Now you may have noticed that I'm catching the limb at the top of the concentric rep, and before the eccentric, I'm making sure she's not preloading into it. Now if you look at your concentric and eccentric box on the left, you'll see that each rep has gotten a little bit higher and higher, and that represents the 50, 75, and then 100% effort. Next, our athlete gets 1 minute of rest. So now we're going to start the actual test reps. So everything here is 100% effort, and we do a concentric rep followed by an eccentric with about 10 seconds in between. Unless they're starting to get tired, then I'll give a little bit extra rest. So there's our one concentric rep, and now we're going to click the eccentric next rep button. And you might notice this rep looks a little bit funny. That's because she started to press and then actually pulled down with her hamstrings and then pushed up again. So it got a little funky, so I had her redo that rep. Now we only need 3 good reps, concentric and eccentric, but you have 10 opportunities to get those 3 reps. So it's not uncommon to get a bad rep. And also you'll see that the patient many times will get more and more torque as they go, and you'll see that with her as well. Now lots of times you'll see that torque get higher because unless that patient has been eccentrically loading at maximal effort, which typically they won't if they're coming to see you, that neuromuscular inhibition that they have goes away as they load rep after rep. So it's kind of a neat phenomenon to see. So if you look in the concentric box, I'm going to click next to reps 1 and 2 to record those. And then I'm going to click zoom on the eccentric box because I like that blue line, rep 3. So I'm going to click next to that one and then zoom back out. Now when you click to record a rep, you can always unclick it if you get a better one later. Sometimes you get an athlete that just knocks out 3 good reps in a row, and if that's the case, always take a couple more just to see if that's truly their maximum. If you start to notice your athletes getting fatigued, usually around rep 3 or 5, give them a little bit extra time. Another 20, 30 seconds, or even up to a minute can really help them get the best reps that they can give you. Now if you look in that concentric box, I unselected reps 1 and 2, and I clicked on reps 4 and 5 because she started giving me more torque as she went. Also, let's look at the eccentric. I now have rep 3 and 5 selected. So now we just need 1 more rep each. So eccentric rep 6 was much better than 5, so I got rid of 5, selected 6. That rep was nothing to write home about, so let's not keep that one. But that last eccentric rep, that was good, so let's take that one. Then we just need 1 more good concentric rep. And there it is, that's a good one there. When you get that many reps going, that's where that zoom feature can really help you out. Now we're moving on to the hamstring, and this is the warm-up. So she's going to have 2 reps at 50%, 2 at 75%, and 1 rep at 100%. So on her concentric rep, she pulls down as the adapter moves down. On eccentric, she pulls down as the machine lifts her up. Now you don't have to test the hamstring of every patient. I usually only test those of our ACL reconstruction patients. But for our typical anterior knee pain, medial knee pain, patellar tendinopathy, osteoarthritis, the patients that I really just suspect or I want to test that extensor mechanism, go ahead and just test the quad. That's where you get to use your clinical judgment. So this is our last rep at 100%. Just like with the quad, give your patient at least 1 minute rest between the warm-up reps and the test reps. The cue I'm giving her here is to continue to pull down all the way through the top of the motion as it lifts her up into extension. Now, you typically won't get that neural inhibition with the hamstrings like you do with the quadriceps. So typically, you can get your 3 good consistent reps much faster with the hamstrings than you do the quad. When I zoom in on the eccentric box, you can see that rep 1, the red line, she stopped at the top of the motion, whereas in rep 2, the green line, she continued to pull all the way through the top. So I'm going to click rep 2 to record that. Now I like all 3 of her concentric reps. The torque amount is good, the curves match each other closely, so I selected all 3. Also, that last eccentric rep was good, so I clicked next to rep 3 also. So her 4th eccentric rep was really good with a high torque amount and a good curve, so I unselected rep 2 and I kept rep 4. So let's do one more rep to see how she does. Now it's not as good, so I went ahead and clicked back on rep 2 again. Now I have 3 on each, so we're all done with the hamstring and we're all done with the right leg. So now we're just going to turn the whole chair assembly so we can test the other leg. Now she doesn't have to move at all. First thing to do, go ahead on the software, tell it the other limb, that unlocks the adapter. Now you can move the thigh strap, you can unhook the adapter from the leg, and you can move that contralateral limb stabilizer. Now you can stay on this side of the machine for this next series. Unlock the chair rotation, swing the patient to face the back side. Now stay on that same side. Unlock the dynamometer rotation, swing it well beyond that 40-degree line. Now you can rotate the patient's chair over, lock it in right at the 40, and then from there you can move to the other side. Now that you're over here, go ahead and move the dynamometer to rotation at the 40-degree line. If you didn't move it beyond the 40, when you swing the patient over, you would have hit their leg up against that adapter. So you always have to adjust that after. Once you're there, check your alignment. And now we're going to go through the same process of setting the anatomic 0, making sure to back off just a little bit before you click Set AZ. Now on this screen, there's a button that says Mirror Range of Motion. Click that button. That ensures you get the exact same range of motion as the other limb, and it's much faster. All you have to do is move the limb through the range, and it automatically gives you the green dots, so you can set your range of motion, set your mechanical stops, and be ready to weigh the limb. And you can see the gravity correction weighing the limb is a really fast thing. It doesn't take a lot of time to do. So now we're on the first of the warm-up reps. And as you can see, she was a little confused on rep 2. She initially pushed up, then pulled back down. So it gives you that funky line. Remember, it's not just warm-up, it's familiarization. And after they go through the quad and then the hamstring on the other side, when they come to the other limb, you have to retell them or reteach them how to do the quadricep again. So I'm explaining to her here how as we warm up 50, 75, and 100% effort, that we want to keep that pain threshold ideally below 3 to 4 out of 10. If it goes above that, I want her to tell me because we don't want to have her push that hard on that injured limb. So we wanted to have them test at that pain tolerance. Again, about 3 to 4 out of 10 discomfort is okay, but above that we don't want. So we use that 50, 75, and then 100% effort as a way to judge how hard she should push for the test. And I noticed from her reaction, as well as the torque amounts and the torque curves, that it's not feeling ideal. So I had her slide over in the seat a little bit, then I adjusted her position, and she tells me that it does feel a lot better. She felt fine at 75% after I adjusted the position, so we moved on to 100% effort. And you can see that as she warmed up and I adjusted that position and she went from, the 50 to 75 to the 100% effort, her torque amounts got better, her curve lines actually improved to that ascending descending curve. So that's what we want to see. And now she gets at least 1 minute of rest before we move on to the test reps. Just like with the other side, I need 3 good consistent reps, but it's probably going to take more reps on the injured leg than the uninjured leg, just because with the injury, they're going to get that neural inhibition, especially in the eccentric side. So it's not uncommon to take 5, 7, sometimes even all 10 attempts to get your 3 good ones. And you can see the interrupted stroke test takes longer than the standard test. Now, if you're only testing the quadriceps or if you're just retesting one limb, it doesn't take as long. But typically, for somebody like her who's never been on a machine like this before, and you're testing both limbs, both muscle groups, it takes you about 30 minutes from start to finish. Again, if your athlete is used to this machine, or if you're testing only one muscle group or only one leg, it's much faster than that. So you can see her reps are actually looking pretty consistent already. That's good. Let's go ahead and select the second and third rep of the concentric box. Let's move to the next eccentric rep. So there you can see she had a much higher torque, but at the top of the motion, she kind of flattened out a little bit. And in this pause, I'm explaining to her what her torque looked like on that last one, that she actually had a better torque amount, but she kind of leveled off versus pushing through the end of it. So that's why you're seeing a pause right now. And again, you're seeing that phenomenon here that as she's loading her quadricep rep after rep at 100%, that inhibition that she has from the injury is reducing, so she's getting higher torque amounts with better curves. So I'm just looking at her reps to make sure which ones I want to select for recording before I move on to the hamstring. All right, we're on the last muscle group of the second leg. So let's warm up the hamstring just like we did on the other side. And again, always ask them how they're feeling after you move on from one percentage of effort before you go to the next. She tells me that it's feeling okay. And you can see she's giving good effort. Your athlete should be squirming in the chair, turning red, making faces, grunting, spitting a little bit. If they're not visually giving you good effort, stop, take a moment just to talk to them, make sure they understand what they should be doing. This is our last 1 minute rest before we do the test reps for the hamstring. So again, you can see on that eccentric box just how much better her second rep was compared to that first one. Now we just have one last concentric rep to record. After you have all of your reps, click OK, and then on the testing screen, click OK again. That'll bring you to the report screen. For the interrupted stroke test, when I'm testing both muscle groups, I like to use the long form torque versus position. That way I get one whole sheet with graphs and data for the quad and a whole second sheet of data for the hamstring. Now you can either click preview to pull it up on the computer itself, or you can click print, which will pull it up on the computer anyway, but it'll also print. You can even print from the preview screen also. After you unhook your athlete from the adapter and from the thigh strap, go ahead, lock in the adapter, slide the chair out of the way, and then have them climb off from the left side. In this case, the left side. That way they can step down onto the platform before lowering, and always warn them that their legs might be a little wobbly. So here I'm going over the test results with her. Now lots of times your athlete, you're going to have them do a cool down, which gives you a chance to analyze it a little bit first, but her test was pretty straightforward, so I was able to go over it with her right on the spot. So that's the whole process from start to finish. It took me 30 minutes to do her test. That's including the 4 1-minute rest breaks that she had. And when you have 60 minutes with the patient in the clinic, that's not hard to do. We've even done it where you're performing this test while you have other patients. And it might mean that your athlete on the machine gets a little bit more rest between her reps as you're instructing that other patient in an exercise or setting them up on something else, and that's okay. But it's very reasonable, and it's not that hard to do once you get the hang of it. Okay, so she did very well in her test. Across the board, she was about 20% deficient in her quadriceps bilaterally in both concentric and eccentric, and same thing with her hamstrings, about 15 to 20% deficiency, both concentric and eccentric. Not too worried about it though, because her injured limb was at her body weight standards for athletic activity. Her uninjured limb was just well beyond that. So I'm gonna now break down a test report, and I'm not using hers because it doesn't show us much. The athlete we're going to show you is one of our lacrosse players that was sent to us at 5 months post-op ACL because his athletic trainer knew that he was not putting in the work that he needed to do, and it was the end of the spring semester, and she wanted to kind of light a little fire under his butt before he went home to for the summer. That way he knew that he wasn't where he needed to be. So that's what we're going to see next.
So this is the test report for the quadriceps. At the top, we see 2 graphs. The graph on the left is concentric, and the graph on the right is the eccentric. The blue lines represent the right side, and the red lines are for the left side, which in this case are the involved side. We can see by looking at the graphs that even though the left limb on the concentric side did very well compared bilaterally, it has a significant eccentric shutdown as the range of motion increases beyond 50 degrees. And remember, we want that range of motion to peak out around 60 to 70 degrees or beyond. I outlined 3 columns here. The left is the numeric data for the concentric side, the middle is the eccentric data, and the right side is the ratio of the two. The first row of data is for peak torque. The middle row is the work per rep, which is analogous to average torque for the entire range of motion, and the bottom row is the data for power. Let's look at the peak torque data. Concentrically, when compared bilaterally, as with what most therapists do, he's actually 1% stronger on his surgery side. But when we look at his torque to body weight, he achieves only 65%, and we know that with research, this should be 100%. So what he actually has here is significant weakness bilaterally in the concentric mode. On the eccentric side, he has only a 17% strength deficit compared bilaterally. But let's look again at his body weight comparison. He hits 82% of his body weight with his uninvolved limb and only 68% with his involved side. Now, ideally, the peak concentric quad should be 100% body weight, and with appropriate training, research tells us that the eccentric should be 10 to 30% greater than concentric. So that means we're looking for a peak torque eccentrically at peak torque to be 130% of his body weight, and he's nowhere near that with either leg. In fact, with the surgery leg, he's only about half of that, and with the uninvolved side, he's 63% of that. So big eccentric deficits bilaterally. The difference is that his uninvolved limb doesn't show that big eccentric neurologic shutdown like the involved side does after 50 degrees. The ratio of eccentric to concentric for the right side is not bad at 126, but the left side is only 105. And again, we want 130% for this eccentric to concentric ratio. Next, let's drop down to work per rep data. And this tells us how strong the average strength is throughout the entire range of motion, which I think is more important than just the peak torque. He actually is 5% stronger compared bilaterally, but let's look again at his body weight numbers. Now, in a moment, when we go to the eccentric side, we're going to tell you that we want his average eccentric work per rep strength to be 100% of his body weight. And given that there's a 30% greater eccentric strength, that means that for the concentric side, we want this to be about 75 to 80% of his body weight. So again, we see a big bilateral concentric deficit. Eccentrically, we see a 22% bilateral deficit of the involved side, but let's look again at that body weight comparison. Remember what I just said about the eccentric work. We want it to be 100% of the body weight, meaning that for the average strength throughout the range of motion, the athlete should be able to handle their body weight with just the quadriceps for decelerating the knee. Here he hits 78% on the uninvolved side and 61% on the involved. So here's where you see the difference in that strength over the entire range of motion versus just the peak torque. This gives you a better understanding. And if you look back at the eccentric graph, he matches the torque curve well until about 45 to 50 degrees, and that's where that drop off occurs. Now, this isn't abnormal for us to see because a lot of our athletes at this point have been doing step downs and things like that and working in that 0 to 45, 50 degree range, but not going any deeper than that. Again, our ratios mirror what we saw at the peak torque data. When we drop down to power, we see that his rate of force production deficits pretty much mirror his strength deficit numbers in both concentric and eccentric. Lastly, let's make a note on the coefficient of variance, and this is a measure of how closely the three reps match each other. We're looking for a 10% variance or less, and some people allow up to 15%. Now, his test was very good. He only had a 0.06 or 6% variance maximum between all of his reps, and that's a good test. And we always see a very low coefficient of variance with the interrupted stroke test. This is the hamstring report. Like with the quad, we have the concentric graph on the left and the eccentric on the right. The right limb is in blue and the left is red. And again, that's the patient's involved side. So you can see he has deficits throughout the range of motion in both concentric and eccentric modes. The peak torque for the concentric hamstring shows a 16% deficit compared bilaterally. With the body weight comparison, what I'm going to do is take the parameters we use for the quadriceps, but use 60% of those numbers, as we know the hamstring should be about 60% that of the quad. So here we want the peak torque hamstring to be 60 to 70% of the body weight. His uninvolved side hits 38% and the involved side hits 32%. So again, both are only just half of what we want. Eccentrically for peak torque, we have a 12% bilateral comparison, but for body weight, we're looking for about 80% of his body weight. Again, I took the 130% body weight from the quad and multiplied that by 60%, which gives us 78%. So I just rounded it up to 80 to keep it easy. Here, our athlete hits 52 and 46% of his body weight with the uninvolved and involved side, respectively. So again, we're just over half of what we're looking for. The ratios look great here as they're both well above 130%. So that tells us he's got a good eccentric training to the hamstrings. Dropping down to work per rep or average strength for the hamstrings, concentrically, we see he has a 22% deficit compared bilaterally, and the body weight data here should be about 45 to 50% of the body weight, and he hits 37 and 29 with the uninvolved and involved side. Eccentrically, we see the 29% bilateral deficit, and the body weight standard here is 60% of the body weight. The uninvolved gets close at 50%, and the uninvolved is at 35%. Again, we have good ratios. As with the quads, the power data for the hamstrings mirrors his strength data. Now let's look at the hamstring to quad ratios. The standard way to analyze this is with the concentric hamstring to the concentric quad, which gives you a ratio ideally of 0.6 to 0.8. But given that you now have eccentric data, you could look at this differently. You could look at the eccentric to hamstring to the eccentric quad, which again should be 0.6 to 0.8. But we like to take what's called the functional ratio, looking at the eccentric hamstring to the concentric quad. And what we want to see is that they're very close to each other for a ratio of 1.0. And this is important because the hamstring will fire eccentrically against the concentric quad to control that tibial translation anteriorly. And we want this to equally match each other. Here's an outstanding article by Ruiz et al., which recently was published in 2019. And it looks at the functional ratio and it describes it. So check it out as it has great information about that. So if we look at our athletes' numbers and the ratios, the ratio for the standard con, his right uninvolved side was at 0.66, which is good, and his left was at 0.49. So really not far off from that 0.6 that we're looking for. We pretty much get the same ratio if we look at his eccentric hamstring to his eccentric quad. But if we look at his functional ratio, he's only at 0.89 for the uninvolved and 0.59 for the involved limb. So this again shows us deficits that we wouldn't have picked up on unless we tested eccentrically. So let's interpret the test. If we only did the standard con test, we would have seen that his quad strength was great, 1% stronger on his limb symmetry. His hamstring would have shown up as slightly weak at 16% deficit, so I listed this as red because you want 85 to 90% limb symmetry. Also, his ratio would have come up as deficient, but again, just outside of that normal. So we would have said, go ahead, get started with your return to sports activity, and we would have felt confident sending him back to play. But if we use the interrupted stroke test looking at the eccentrics as well, we would have picked up on his huge bilateral quadricep deficit with that significant neurologic eccentric shutdown on the involved side. We would have picked up on the hamstring weakness bilaterally, and using the functional ratio, we would see that there were bilateral deficits as well. So when his athletic trainer sent him to us at 5 months post-op in April, she knew that he was nowhere near where he should be, and she wanted him to see those objective measurements firsthand. So after this test, he went home for the summer break and continued to work on strengthening aggressively. He came back in August at 9 months post-op, and he increased his strength by about 30 to 40%, which was better, but not where he needed to be still. So he continued working on his strength and rehab with his athletic trainers, and he returned to us in October at 11 months post-op. And at that point, he met his minimal strength requirements, and we felt confident sending him back to full college-level lacrosse.
Okay, everybody, you're stuck with me so far. I have one last video showing the standard isokinetic, concentric hamstring and quad test. This one is much faster than the last, so stick with me and then we'll finish up.
In this video, we're going to see the standard concentric hamstring and quadriceps test. So go to the patient menu and select your patient. Then click test, select the joint, and then select the protocol that you're going to use. Now we're only doing one speed here, so you can click single set or all sets. So let's go ahead and set up our patient. The patient for this video is Rob Potash from CSMI. Hi, Rob. Now I'm only going to do the slower speed with Rob, and a lot of therapists are choosing to only do the one speed even in the traditional concentric test. It used to be thought that doing the faster speed would give you a better measure of power, but if you look at that force velocity curve of an isokinetic, the faster you go concentrically, the less force output you're going to get. Now, if you do a fast concentric when the velocity isn't fixed like in the isotonic, yes, you will then get a good measure of power, but not when the velocity is fixed like isokinetic. Now, if that's confusing, go back and review episode 6, Isotonics, where I discuss the difference between the force velocity curve of isokinetic versus isotonic exercise. Another question that's been brought to me lately is, what happens if they pass the slower speed but not the faster speed? Does that matter as much? And in my opinion, and this is just my opinion, no, it doesn't. That faster speed, when I do use it, I'm looking more at the fatigue that they get over those 15 reps. Now, the problem with the fatigue index is it measures the first 3 reps and how it compares to the last 3 reps out of 15. So if that athlete starts out their first 3 or 4 reps and then they really figure out what they're doing and they're picking up the intensity, that's not going to give you a good measure of their fatigue. So you only get a good measurement of how they actually fatigue if that athlete truly understands what to do in the test and they really explode out the gate. When you set your range of motion, make sure you standardize it. I like to go 10 degrees to 90 degrees. John likes to go 10 degrees to 80 degrees. Now, this is important that you standardize it because when you test bilaterally or even doing a retest, your work per rep data won't line up unless it's actually the same range of motion. Rob's going to have 3 warm-up reps. The first is easy, second is medium, and the third is hard. He's pushing up with his quad and then pulling back down with his hamstring. And here you can see the difference between the easy, medium, and hard reps. After a short rest, the test is the same. All 3 are going to be as hard as he can, but it's 3 reps, pushing up on the way up, pulling down on the way down as hard as he can. Here you can see the variance in the torque curves of his quad, but his hamstring lines up pretty closely. Now, if we were doing the faster speed, we would go right into the warm-up for the faster speed and then the test of the faster speed. Since I'm only testing Rob at the slower speed, we're going to go ahead and switch sides. Now, I will include a clip of another one of my athletes doing the faster speed at the end of this test. Now, if you are going to do the faster speed, you have 3 warm-up reps. Again, it's 1 rep easy, 1 medium, and 1 hard intensity, and then 15 reps for the test. And all 15 of those are as hard and as fast as you can. Now, pay attention to how I'm going about changing sides. If you use this method, it'll make that change in, from right limb to left limb really fast and save you a lot of time on your tests. Now, what I'm doing here is I'm turning the adapter pad. It's offset to one side. So if you flip that, if your athlete, when you switch sides, they're not exactly lining up with the pad, you can simply flip that and then they'll line up perfectly. So now we're going to repeat the process for the left leg. And while I'm doing the setup, I want to make a comment about diagnosing injuries from the torque curves. A lot of work has been done in the past looking at various shapes of the curve and what they mean pathologically. And our standpoint is that, yes, isokinetic testing can show you that there is pathology, but it can't tell you exactly what pathology. That's what your MRI is for. Remember that when setting your anatomic 0, have them lock out to full extension and then just back off just a little bit. Now, I've already tested Rob before, so his range of motion for this side is already put in, but if it's not there, you can click that mirror ROM, and then all you have to do is run him through the range of motion, and it'll match the exact same extension and flexion stopping points from the other limb. You may also notice that I'm not weighing his limb. Now, we've already tested Rob multiple times that day on the different isometric, interrupted stroke, and then the standard test. We just did this test again for the purposes of the video, so we didn't go ahead and weigh it, but I always like to weigh that limb. So here's the warm-up, 1 rep easy, 1 medium, and 1 hard, pushing up on the way up and pulling down on the way down. After a short rest, Rob's going to have 3 test reps as hard as he can. Now, you can't hear it because everything's muted, but during testing, I get pretty loud. You want to give them good verbal encouragement. And you can see by the shape of his quadricep curve that he is having a problem. He tweaked his knee a little while ago. It's feeling a lot better now, but when we did that interrupted stroke test and we got the eccentric data as well, he had a pretty good eccentric shutdown on that left side in his quadricep. And many of you don't know this, but Rob is actually a very high level competing CrossFit athlete. and he's just coming off of this knee injury, and he's getting ready for the next CrossFit Games, which start very soon. After your test is over, go ahead and click OK. That takes you to the report page. Once you're there, you can hit print or preview. Then once it prints off, go over it with your athlete, have them do a little cool down, and then you're done. Now stay tuned, because in a moment I have a clip of an athlete performing the 300 degree per second test. And here you see Chris Fernandez running our athlete through the 300 degree per second test. It's 15 repetitions, and it's still concentric quad, concentric hamstring. So you're pushing up on the way up and pulling down on the way down.
Okay, everybody, that is everything for episode 9. The questions that were submitted to Rob and also asked to me, I tried to include those in the presentation. So if you asked a question, hopefully I answered it for you. But if this brings up more questions or something you haven't thought of, shoot Rob an email. I left his email address at the beginning. So go ahead and shoot him an email. That way we can answer those. And I would like to invite John back on as well. If he's able to, if he still has a signal.
Yeah, Daniel, I think I'm
fantastic. So next month, I'm going to cover the lower extremity and how to put it all together, the Isokinetic plan of care. The month after that, John is going to take the upper extremity. Now, being in Florida, John has seen so many baseball players and pitchers. He's seen more of them than I've changed diapers in the last 2 years. Let's just say that. So he's going to do the same thing for the upper extremity and how to put it all together isokinetically for the upper extremity athlete. Comments on that, John?
No, I think that one of the things that we want to do is just kind of show the entire lineup of everything that we've utilized up to this point, and make sure that everybody knows how we're kind of utilizing this device, not just for testing, but for training purposes also.
Absolutely. All right. Rob, if you don't have any questions, John, if you don't have anything else to add, we'll go ahead and call it a night.
Great job, Daniel. Thank you very much.
Well done, Daniel.
We'll
Johnny, have a
see
great trip.
everybody next month, and thank you all for joining us.